Well, welcome everyone to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. Today, my friends, we're going to learn about the inpatient rehabilitation program that we have here. We have it right here in Hazleton. Two great guests. We have Dr. Chen, who is the medical director of the Gunderson Center for Inpatient Rehabilitation, and Lynda Naperkowski. Isn't that a pretty name? Director of Clinical Services at the Gunderson Center for Inpatient Rehabilitation. A lot of great things we have available to us in our area, and I say it all the time, Lehigh Valley Hospital Hazleton just keeps raising the bar all the time. Welcome to the Sam Lasan Show and to your health partner. Okay?
Thank you.
Which you are, you're our health partner.
Thank you for having us.
Where are you from originally?
I'm from Asia, in a city near Shanghai. Yeah.
How long have you been here in the United States?
I've been here for a while, almost 10 years. Initially, I went through a master's degree at Boston University, then went through a residency at Geisinger nearby here. Then I moved here for Lehigh Valley Inpatient Rehab at Gunderson Rehab Center.
Yeah. So tell me a little bit about your background in medicine.
Yeah, so my background, my journey toward medicine is deeply influenced by my family. My father's a neurosurgeon. So at a young age, I already witnessed a lot of debilitating conditions, including stroke, brain hemorrhage, significant trauma. So I witnessed all those patients suffer significant disability after the injury, and they have difficulty returning to their normal lives. So I grew a strong interest in the healthcare. So I went through medical school, and during that time, I discovered the specialty of physical medicine and rehab fits my interest very well. Not only the aspect of recovering patients from disability, but also the musculoskeletal care. And because of my strong interest in basketball and sports, so I think those combine my interests very well. So I decided to pursue a residency in physical medicine and rehab.
Your goal then for the patients is what?
Restore patients' function, improve their quality of life, and help them return to their previous level of living. For example, a lot of patients we treat at the Inpatient Rehab Center suffer significant life-changing injuries, including multi-trauma, car accident, stroke, spinal cord injury, brain injury. And those over there, I collaborate with multidisciplinary team, including all the therapists, physical, occupational, speech therapists, and great rehab nursing like Lynda, and the social worker and the nutritionist to optimize their recovery and help them back on their feet.
Your role at Gunderson is one.
Yeah, so my role at inpatient rehab is supervise the rehab program. So there are a lot of the therapists there. So for a certain condition, for example, stroke, they may need physical therapy to strengthen their legs, help them back to their feet again, start walking again. Because after stroke, you have significant weakness on one side, and usually people it's difficult to walk. And they need occupational therapy for activities of daily living, like basic things like bathing and dressing and eating. Because sometimes after stroke, your swallowing muscle is very weak, you're unable to swallow. And we also have speech therapy help with their swallow training and speaking and then cognition assessment, etc. And also supervise the medical, physical, and the emotional aspect of the recovery. Because sometimes after the devastating injury, people have a lot of depression, so we have to help them with that too. And I also supervise the nutrition and the discharge aspect of the patient, help them reintegrate into society.
So there's a vast number of things that you do, okay? And it always amazes me as to how do you know what to do for each individual patient?
Yeah, I adopt a patient-centered approach. I tailor each individual patient's recovery with a very detailed, individualized approach. For example, I initially conduct a very thorough assessment regarding where patient's weakness and any deficits is, and I tailor my medical treatment plan, rehab treatment plan, mental treatment plan, and I was discharge planning in fitting the patient's case in a very, very detailed fashion, individualized fashion.
So you have to know, there's different degrees, I guess. Okay.
Yeah, there are different degrees of injury, different pathophysiology and mechanism of their injury. So we tailor treatment towards those.
What kind of experience do you bring to the hospital?
Yeah, so I went through the training at physical medicine rehab nearby residency here, and I also did a lot of research and previously in Boston near the in the hospital, Mass General Hospital, Harvard affiliated. I did a lot of burn care research there. So that's a rehab program targeting burn patients. That's an important aspect of one of the devastating injuries too. So I bring those research experience into the recovery of the current patients here. Although we don't have much burn patients here, but we can integrate their evidence-based mentality and those research mindset into the current evidence-based practice in our rehab patient-centered as well.
Evaluation is always so important, okay, in evaluating what that patient needs, all right? And that's where I think, you know, you're depending on the doctor to appraise you of what, you know, you're going to do. So there are levels, right, as to inpatient rehabilitation, correct?
Yes. Yeah, so our rehab center is the highest level rehab.
What do you mean when you say the highest level rehab?
Yeah, so this Gunderson Inpatient Rehab is a special rehab center. It's 3 hours therapy a day. It's the most intensive form of rehab. There are other rehab facilities. Sometimes they only do 1 hour a day, even less. And the other level is home health. Basically, patient discharged home, but we send some physical therapy to their house, but only a couple times a week sometimes. So our inpatient rehab is a specialized form of facility that has have a special regulation that have to be doing 3 hours therapy a day with daily supervision of specialists in rehab, and physiatrists like me, and also other healthcare professionals, including hospital medicine, internal medicine physicians, and all the therapists. They have to see patients 3 hours a day. So that's a special form of rehab facility we have here. We tailor the therapy program to their individual needs. We don't do it consecutively 3 hours. We do half an hour there, half an hour there. It's not like in a row 3 hours. So they can have the best recovery and do some rest between the therapy sessions.
You have some examples of people that, you know, that when you see them, it's like, wow.
Yeah, there's a good example recently. We have a patient, relatively young gentleman, came in with a brain hemorrhage, brain bleed, and he had significant weakness in the one side of the body, completely cannot move. And he has difficulty swallowing, cannot eat regular food, have to chopped up like pureed food. And he came in that we designed the 3 hours intensive therapy, and he has strong motivation to get better. And not only he does work very hard during the therapy sessions, but also he's also practicing his own exercise in his room. So after 3 weeks of intensive therapy, he was able to walk without any assisted device, like no walker, no cane. He can walk on a level surface without any device, and he is able to start talking very well. Initially, he has a lot of slurred speech. And after 3 weeks of speech therapy, he was able to communicate very fluently and able to eat regular diet, able to go home with his wife. So that's a very inspiring story that the patient can receive a lot of recovery throughout our rehab in only 2 to 3 week span.
How do you know what patients should go into the Gunderson unit?
Yeah, so we have a very thorough evaluation process. So not everyone is suitable for inpatient intense rehab. Some patients are unable to tolerate 3 hours therapy, so we have the plan for some other facilities. But for some patients who can tolerate and meet specific diagnosis, I go down to do consults downstairs in the hospital and to meet with patients to assess if they are a suitable candidate for inpatient rehab, and we bring them in.
Hmm. You know, Gunderson has always had a great reputation, you know, in inpatient care, as I think some people, you know, don't really understand the full scope of what we have available to us. How does this benefit the community? I mentioned here that now we have this in Hazleton. Not that we didn't have it before, but the point is now at a higher level. I would think so.
Yeah, I think inpatient rehab facility overall is a critical component of the I consider it as a bridge between acute hospital stay and home, because a lot of patients suffer significant injuries, stroke, heart attack, car accident, a lot of bone fractures. They can't go home immediately after the hospital stay. You had a surgery, fix the bone, but you're unable to walk, very weak, and a lot of medical conditions that's unstable need to be supervised in a very closely supervised session area to help them recover. So I think Gunderson Rehab is serving as a bridge between the acute hospital and the community. And not only we help them recover, but also overall we can decrease a lot of overall healthcare cost and decrease the readmission and rehospitalization rate and help patients reintegrate into society much better.
So you determine who comes into the unit, right?
Yeah, the other doctor can make suggestions, but we usually review the case with myself and the other leadership, including Lynda and other rehab specialists in the unit.
To determine whether they could...
Whether it's a suitable candidate for the inpatient rehab.
And do you have a time period if someone says, how long do you think it's going to take for my dad or my brother or my husband or my wife or whatever, to get somewhere back to normal?
Yeah, it depends on each different diagnosis and the severity of each case. But usually the inpatients stay here usually about a couple weeks, 1 to 3 weeks.
Okay.
But recovery is always lifelong. I think you should consider inpatient rehab as a boot camp. You learn how to do rehab there.
Excellent, yes.
And they help you do rehab, but it's not like a passive process. After you go home, you still need to engage in active exercise to help you continue to get better after getting.
Now, do you follow up with them when they're at home with different inpatient?
Yeah, sure. Yeah, sometimes usually for stroke patients, some certain diagnosis, I arrange them follow up in the wellness center, and we continue to monitor them. For example, stroke, you have a significant side effect, like a complication after stroke is a muscle spasm. So after the stroke, you can have developed significant spasticity in the muscle like this. So we need to use a lot of the medications, including oral pills. Sometimes we need an injection in a botulinum toxin to help them release the muscle and continue the rehab to achieve best outcome. So that needs longitudinal management there.
I could see you know what you're doing. It's good to know that, there's a lot of things that are involved that people don't know that. All they're concerned about is for their loved one to get better and make sure that they're in the best care. And it seems like you're the person that's doing a great job up there. Anything else you'd like to add?
Yeah, so not only I do Gunderson inpatient rehab work, sometimes I do outpatient half a day at the wellness center. I also conduct some musculoskeletal, treat those conditions. Also, I do EMG studies. EMG stands for electromyography. It's a nerve conduction study. Some people have nerve injuries, have numbness, tingling in the arm, like carpal tunnel syndrome, some compression here, traction injury in the shoulder. Through EMG test, we can diagnose where exactly is the issue, like where is the nerve injury, can better guide the treatment options and continue recovery there.
Dr. Chen, my friends, who is the medical director of Gunderson Center for Inpatient. Interesting, isn't it, that we have this great talent here in Hazleton. Now we're going to show you a little tour here of the Gunderson unit, and after that we'll be back with Lynda Naperkowski.
Lehigh Valley Health Network is the region's most trusted rehabilitation partner. Gunderson Inpatient Rehabilitation Center at Lehigh Valley Hospital, Hazleton, helps people reach their highest level of independence. So how do we do it? It starts with a home-like environment so you can practice everyday tasks. We've even prepared people for real-life scenarios, like getting in and out of a car, to ensure that when you've completed your stay, you have added confidence. Rehabilitation patient rooms are a space for you to unwind while having the comfort of being in a hospital setting. That means if something unexpected happens, care is close by. Talk with your physician to see if inpatient rehabilitation services are right for you or your family member.
Well, welcome back to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. My friends, learning about inpatient rehabilitation, we have it right here in Hazleton. You heard from Dr. Chen. Now we're going to talk to Lynda Naperkowski. What a beautiful name. Director of Clinical Services for the Gunderson Center for Inpatient Rehabilitation. Thanks for coming on the show, Lynda.
Thank you for having me. I'm thrilled.
So tell me a little bit about yourself.
I'm a master's prepared RN, and I'm a certified rehabilitation registered nurse. I've been with the network for going into my 22nd year at the Gunderson Inpatient Rehab. I love it. I love rehab. I love helping people get back to where they need to be to continue living.
You know, the interesting thing about having that experience that I find is that when you have a loved one who has had a stroke or whatever, and you're coming in and you're telling them who you are, and you got 22 years, you've seen a lot, so even though you may look at a person who's in a very difficult situation, hurting, you know, with your experience, you give them some hope. Not that you have a magic wand and guarantee, but you know, look, I've been here, I've seen what when we go through our rehabilitation, we're going to have a pleasant outcome. Do you find that?
Absolutely. And in most cases, that is the outcome, positive.
Yeah, I mean, the know is you've done this before, you know, and it's encouraging. Where is the Gunderson Center for Inpatient
It's
Rehabilitation?
located on the 6th floor of the Lehigh Valley Hospital in Hazleton. The entire floor is devoted to inpatient rehab.
And you just love it.
I love it.
Yeah. Tell me some about some of the services and therapies and treatments that you do.
Well, one of the first criteria that a patient must have to come to the IRC is required 24-hour nursing care. So even if we think about someone who perhaps had a hip repair or some type of a surgical procedure and they've become debilitated, they come to our department, they may need blood. So we will transfuse the blood. They may need a heparin drip to help prevent any type of clotting. Nursing will do the heparin drip. There's so much education that follows the entire rehab team that the nurse has to continue to teach. Whatever the plan of care is that Dr. Chen determines to be, everyone follows through with that plan of care.
So it's interesting, Dr. Chen, when a person who has supposedly suffering a stroke and they're coming into the hospital, at one point in time, do you get that person, or do they have to go through different things with, you know, the medical procedures?
Yeah, when patient comes in stroke, usually the first step, there's a treatment in the emergency room, and sometimes they determine whether they're going to deploy the clot buster or not. And neurology doctor, brain specialist, will be consulted, and he or she can review the imaging, like a CT scan, MRI, determine what kind of a stroke that is, and decide what's the best medical treatment plan. Okay. And then next step, they're gonna primary team, the internal medicine team, gonna consult physical therapy and occupational therapy to assess the patient, as well as physiatry, to see whether the patient is a candidate for inpatient rehab.
Okay, so they come up to you, all right? So now, tell me about your team. Okay, because I hear again, it's not you can't do everything. Okay.
No, absolutely not. It is team. It is a team effect, and the center of that team is the patient. And as Dr. Chen said, everything evolves around the patient. So Mr. Smith may not need the same plan of care that Mr. Jones needs. So one thing we will do is in the morning, we are helping the patients to get out of bed. If they are independent with putting their shirt on, then they are putting their own shirt on. If they need help with getting their lower body, then we are helping them get their lower body clothing on. We're doing medication education. If they are a new stroke, perhaps they're on different types of new medications, so we're doing education with that. Many times we're teaching them how to do injections. We're teaching them how to take care of a tube feed, how to do trach care. But our goal at Gunderson, what I can say is if someone comes in with a PEG tube or a trach, our #1 goal is to send them home without that tracheostomy or the PEG tube in the belly. So, but we do a lot of teaching to kind of help that patient. And if the patient's not able to do that, to take care of those things, family involvement is key. We do a lot of family education.
You know, it's funny, you talk about, you know, the years of experience that you have, and certainly impressed so much with this gentleman here. When you're looking at the experiences, 22 years, I always like to say, you know, when I started back in 1994, our cameras were 14 times the sizes. You've probably seen a lot of changes throughout the year. Some of the things in which, for example, having this kind of inpatient service. Am I correct in saying?
Absolutely. And one simple example is the chart. We used to have these big bulky charts with big orders in, and we'd have to write out notes, and to find something in that chart we'd have to fumble through it. And today everything is at our fingertips, right in the patient's room. Computer is there, we open up our EMR, and all the information is there that we need to provide the best care.
So and then you've also seen the level of care just, you know, going back even 15 years ago, 10 years ago, and then Lehigh Valley Network comes in, and I remember when we announced it, oh, we're going to lose our identity. Well, I think we gained a lot of identity, in terms of the best care,
Yes, we have gained so many resources, and it has really been such a privilege to be part of the Lehigh Valley Health Network.
How long is a typical stay in?
Well, as Dr. Chen said, 1 to 3 weeks. If you look at days, I always use 14 days as a round number, about 14 days. However, if you have had, say, an involved stroke and you are making a lot of gains, you may be there 30 days. And many of that is also generated by your insurance.
Of course, you can have visitors, right?
Oh, absolutely. We encourage visitation. Absolutely. Not during therapy hours.
Oh, yeah.
But absolutely.
There are a lot of people that I think could use inpatient rehabilitation that are at home.
Sure.
But do not know how to approach that. What would be some of the telltale signs, doctor, of a person at home that should really think about using the inpatient service?
Yeah, great question. So actually there's a recent case. There's a patient that has a amputation below the knee because of the vascular issue in the knee. And he already went through one round of inpatient rehab after he had immediate surgery in the amputation of the knee. And now he went home, and we help him arrange getting a new leg, like a prosthetic leg, to help him able to walk better. And now he got the leg from the prosthetic provider, and now we're gonna train him to use how to use that leg to rehabilitation better into normal walking. So that would be a great example of that. We can use inpatient rehab as a great tool to help him improve function through the new training for the new leg.
And I just know that because of our area, there are people that could use inpatient services, and to have such a great inpatient facility here, it's very encouraging, and certainly with bringing Dr. Chen on, I wish you the best, doctor. You certainly know your stuff. I hope I never have to see you in a situation that way, but God forbid, it's like, sometimes a person who, with our cancer center, you got good news and bad news. Bad news is someone who have cancer, but the good news is what we have available. Hopefully they extend your life, Your health partner, Lehigh Valley Hospital, is there for you, my friends. Use them when you need them. We'll see you next time.